Good evening, everyone. There's still some individuals who are slowly joining the room as we are starting to admit everyone to the discussion. Thank you for joining us for the College of Education's and the Center for Excellence for Teaching and Learning's colloquium series. I'm Greg Bernard, class of 2004 and Director of Alumni Relations. To provide a little background, this series, which features dynamic educators and administrators making an impact in their respective fields, is intended to establish online forums that engage in thought-provoking and critical dialogue with our alumni, faculty, community leaders, and elected officials. The College of Education and the Center of Excellence for Teaching and Learning endeavor to empower leaders, educators, and parents to address the challenging times while advocating for the principles of social justice in our educational systems and within society as a whole. Now, before we begin, I just wanted to go over a few quick guidelines. In order to avoid any potential audio or visual issues or interruptions to the program, all participants have been muted upon entry, both audio and video, as we will be recording this and repurposing the content. Secondly, if you are viewing from your personal computer or laptop, in order to optimize your viewing experience of the program, we recommend you change your view to active view as opposed to gallery view, as this will highlight the individual who is speaking at the time. This should be located at the upper right-hand corner of your screen. Click Speaker View, then select Active Speaker View. If you're viewing from a phone or tablet, your default view should be set to Active Speaker View. And last, in order to ask any questions, we hope that you would use the chat feature to communicate, which will be monitored throughout the program, and questions shared with the panelist and moderator throughout. Without further ado, I would like to introduce to you the Dean of the College of Education, Dr. Stephen Hegedus.
Thank you, Greg, very much. Good evening, everyone. Oh. There we go. Thank you, everyone. Good evening. The College of Education at Southern Connecticut State University welcomes you to our 2022 colloquium series hosted by the newly established Center of Excellence for Teaching and Learning. Thank you so much for joining us virtually this evening for our second in a series of important and timely talks across this year on mental health as it relates to the art and science of teaching and learning. This series is designed for our alumni and students who are working in schools and studying in college. We also welcome faculty, superintendents, leaders in schools and state and elected officials. As in all our colloquia over the past few years, we aim to bring you speakers that are focused on relevant themes in education today, sometimes challenging and difficult topics, often with multiple perspectives and positions, but always in an open and respectful academic environment. Thank you for attending tonight and for your continued support. It now gives me great pleasure to introduce Dr. Carrie Sassu, Director of the Center for Teaching and Learning, who will welcome our speakers and moderate the session tonight. Thank you, Carrie.
Thank you, Dean Hegedus, for that introduction, for your collaboration, and for your continued support of this series. I'd also like to thank Greg and Doreen from the Office of Alumni Relations for their continued support and continuing to support our connections to our alumni, as well as orchestrating this event tonight. I am very grateful to be in a position wherein I have the opportunity to engage with and learn from individuals both within and outside of our university community. The Center of Excellence for Teaching and Learning is about creating bridges and connections by extending SCSU's reach out into the community, as well as inviting communities into the fold. With this series, of Colloquia, we not only welcome, as was said, not only welcome alumni, but their colleagues and associates, as well as current university students, staff, and faculty into this virtual space. I want to thank all of you for being here tonight, and I hope you will continue to engage with the Center for many years to come. Tonight's colloquium is, as the Dean highlighted, the second in a series entitled Mental Health as it relates to teaching and learning. And tonight's presentation is entitled Mindfulness Tools for Teachers and Learners, Neuroscience Informed Strategies for Emotional Resilience. I'll briefly introduce our speakers and then we'll get on with it. Our presenters tonight are Dr. Dennis Suchodolski, a clinical psychologist and an associate professor in the Yale Child Study Center, and the author of the book, Cognitive Behavioral Therapy for Anger and Aggression in Children. In addition to his clinical research, Dr. Suchodolski works with children and families at the Yale Child Study Center and teaches a course on pediatric irritability and disruptive behavior disorders to the Child Psychiatry Fellows at the Yale School of Medicine. Dr. Michael Crowley also is a clinical psychologist and an associate professor in the Yale Child Study Center. His work examines the brain and behavior correlates of youth anxiety, self-regulation, self-compassion, and addiction risk. He's a developer of group mindfulness therapy for adolescents. Dr. Crowley directs the Courage Lab and the Developmental Electrophysiology Laboratory at the Child Study Center. Dr. Crowley is deeply committed to training the next generation of clinical scientists, and he co-directs the center's postdoctoral research program in childhood neuropsychiatric disorders. So now I will turn it over to Dennis to begin our presentation tonight.
Thank you for the introduction, and
Dennis,
thank you for
Dennis, just
inviting
quickly,
us.
sorry to interrupt. Do we have the sound on for our videos and things? We do have a video that has sound. I just want to make sure. Carrie, do you know?
The video
assume-
should be on, yes.
I
Okay.
assume it
all
will
right.
play through your presentation.
Okay, thank you. So I'm sorry about that, Dennis. You're up.
All right, now I forgot what I was supposed to say. Okay. All right, let's jump to the next slide. Thank you. Thank you, Mike. If you could help us move to the next slide.
There we go.
All right. So in this presentation, we will focus on 4 areas. First, I will say a few words about some of the research findings on the impact of the pandemic on mental health outcomes in children and adolescents, as well as adults. Then we will try to summarize some of the differences between topics such as stress, anxiety, irritability, and trauma. They're related concepts, but they also have important differences between them. The key part of the presentation is on the mindfulness approaches that can be used in everyday life, as well as in the classroom. And finally, because Dr. Crowley and I are both very interested in the brain behavior associations, we will draw some parallels between recent findings in neuroscience and the clinical effects of interventions such as mindfulness. All right. So it has been 2 years, even more than 2 years now, and COVID-19 pandemic had a huge impact on the world, on everybody's life. And in addition to the impact on global health, we also need to be prepared to help children and adolescents and ourselves, because literally everyone has been affected. But people have been affected to a different extent and in different ways, so that by now we're starting to get research findings that can help us inform and guide the intervention. I wanted to highlight 2 studies. One with an online survey of 4,909 adolescents and adults, And if you take a look, the study was actually completed on August 19 of 2020. So it was interesting because it usually takes about a year for a study to be published. So I wanted to know, when was the study accepted for publication? So this study was accepted for publication on August 19th of 2020, and it covered about 6 months of the pandemic. And at that point, 32% of respondents reported clinically significant levels of anxiety, 31% 32% reported significant depression, 31% reported significant anxiety, and 34% reported significant symptoms of post-traumatic stress disorder. The majority, 58%, reported sleep problems, and adolescents endorsed much higher symptoms than adults. And among the predictors of symptom severity, loneliness and perceived stress were associated with greater levels of anxiety and depression. So that was the first study that was conducted almost 2 years ago. And more recently, now on August 9th of 2021, there was a meta-analytic review of prevalence rates of anxiety and depression in children that included 29 studies and more than 80,000 of participants. And this much bigger sample now revealed the prevalence rates that were 25% for depression and 20% for anxiety. And these really are staggering numbers, which show that the rates of anxiety and depression have doubled in children compared to pre-pandemic levels. So these are indeed really troubling results that signal not only the impact on general health, but the pandemic level problems with mental health, particularly in children and adolescents. Mike, next slide. Now, of course, this is just a very broad bird's eye view. Now, we're also trying to get more nuanced understanding what exactly can be related to specific types of emotional difficulties. And this is a recent study from January of 2022 that reports on 405 parents who were surveyed about their children's behavior during 4 waves of data collection. And the question was, which of the 3 types of educational format, right? Fully remote, hybrid, or fully in person is associated with worse types of behavioral health difficulties. And behavioral health difficulties were rated as general mental health problems, and then problems with maladaptive behavior, which is another way of saying temper outbursts and disruptive behavior, and dysregulated attention, which is a way of saying difficulty staying on task. And probably, and not surprisingly, children who were in fully remote education, right, who are learning from home, demonstrated higher levels of disruptive behavior and dysregulated behavior. Next slide. And now, if you can think about pandemic as like being in a 3rd year. So as I was preparing to this presentation and reflecting on our experience, during year 1, it was a shock to everyone. And as mental health providers and parents, our job was to really understand the experiences and cope best we can. And really helping children understand the pandemic and helping adults understand how their children might feel in the pandemic were really important strategy. Focusing on positive coping techniques, trying to normalize the routines best way possible, reducing media exposure in the 1st year, staying healthy and fit, as difficult as it could have been with reduced access and quarantine, keeping positive outlook and optimism, and helping children stay relaxed and give thanks. So staying relaxed and being grateful. So these are the themes that will be part of today's presentation. But overall, that were also the strategies for helping children cope with the stressors of the pandemic in year one, right? So now I think as we're all figured out how to deal with the first initial stress and shock of COVID, we really needed to think about getting through the year and the second year of schooling and helping children maintain social relation, maintain friendships, and build emotional resilience. And when we think about emotional resilience, this is a skill. But this is a skill for coping with specific frustrating events and with anxiety, right? So now, as we are embarking on a third year, there is hope that with these experiences that we've been through, that we might transition from stress to wellness, and that we can put our emphasis on psychological well-being. There's great recognition of work-life balance. There's greater access to mental wellness, even online resources, or greater recognition of the need for mental health support. And the hope is that we will be able to flip the switch from languishing to flourishing. And there is a lot of literature on post-traumatic growth, that even those who are suffering the most severe forms of PTSD don't need to stay the victims of their traumatic experiences, that it is possible to learn from traumatic experiences and emerge with stronger skills and better ways of coping with challenging emotions, right? Next slide. And the important part is to understand that there are levels of stress that can be managed at home by healthy lifestyles. There are levels of stress that can be managed through school-based interventions and through social support. And then there are also clinical levels of anxiety, irritability, and trauma that might require clinical interventions, which could be either short and effective or more long-term. And the approaches of mindfulness that we're going to switch gears, and Dr. Crowley will talk about at length, really harness our abilities to recognize our emotional experiences and to use the power of our emotions towards improving our learning and our family and social experiences. Next slide. And probably the reason for that is because our emotions really are supported by the same brain regions that are involved in social functioning, that are involved in abstract thinking, that are involved in our ability to stay focused and pay attention. So that when we think about emotional brain, we can really identify the regions of emotional reactivity and emotional regulation and the regions of self-control that can help the child to stay focused on their homework or to pay attention in the classroom despite high levels of stress in the world or in their family. And what is striking about treatments such as mindfulness interventions is that mindfulness by now has been shown to optimize the brain circuitry of emotion regulation, social functioning, and attention. Thank you. So that's my part. Dr. Crowley.
Hello, everyone. I'm so excited to speak with you today about mindfulness and its relevance to teachers and students. I will say before I get started, my proviso is that really to learn mindfulness, it takes a bit of effort and investment. And in this next 30 minutes that we have together, 20 minutes or so that I'll be speaking about it, I'll just be covering the high notes. So really, if you want to get into it, it does take a bit of effort, but I can assure you that it's life-changing and worth doing. So first I'll start off with what is mindfulness? What do we mean when we talk about mindfulness? And I'll go to two of the field leaders, particularly John Kabat-Zinn, but also Amy Saltzman. So John Kabat-Zinn defines mindfulness as mindfulness means paying attention in a particular way on purpose in the present moment and non-judgmentally. And so really those core aspects of being present and with non-judgment are critical to the mindfulness approach and perspective. And Kabat-Zinn was one of the forerunners, taking some of these ideas that really came out of Buddhism, but are now secular approaches, and using them to treat a range of emotional and medical concerns. He was the designer of the mindfulness-based MBSR, mindfulness-based stress reduction program up at UMass Amherst. And it's really, paved the way for many people and the application of mindfulness skills to children and across society. And then Saltzman's approach, which is slightly different, but largely says the same, largely says the same thing: paying attention here and now with kindness and curiosity when choosing your behavior. And I really like this definition too, because it kind of fleshes out a bit more. If you're in the stance that Kabat-Zinn's talking about, you engage the world in a way that's more open and flexible and warm and kind, and that has reciprocal effects on the individual and those around him or her. So in terms of mindfulness, there's been an explosion of interest. You probably see if you search for books on mindfulness, there are dozens and dozens applied to all different situations, and peak performance and sleep and mental health and teaching and children and parenting, you name it. We know that it supports wellness, and the outcome studies, which I'll talk about very briefly, show that it works with adults and with kids. It shows clear benefit. It can be used to alleviate pain. In fact, that's where MBSR with John Kabat-Zinn started, reducing depression, anxiety, and a range of different things related to attention and regulation of the self. So what mindfulness isn't? It's not a disciplinary approach. And I remember, I won't say who, was someone that I was working with back in the day, a child, and observing them with one of their siblings say, "Go do your mindfulness," and another time saying someone isn't being very mindful, and I realized that they hadn't really picked up on what it was all about. So it's really non-judgment. It's not calmness or just being happy or relaxing. It's something a bit different. It's not a cure-all either. Some of the things that you already know about, probably in terms of cognitive behavior therapy or reappraising situations, that's not so much what mindfulness is about, but mindfulness puts you in a good spot psychologically to use other cognitive skills that you may already have. Mindfulness is not the absence of thought. So there's a common cartoon floating around, a mind full, mind empty. It's being mindful is not having an empty mind. And then lastly, mindfulness is a secular practice. So they're really, although some of the ideas started in Buddhism, it's moved very much now to a self-regulation skill that's applicable across people and situations broadly. So the core processes of mindfulness involve present moment awareness, non-judgmental and dispassionate quality of that awareness. So you can imagine feeling something and noticing it, but then being able to move away from it and be a passive observer on that feeling or that internal state. And one of the core assumptions of mindfulness is that we're relatively unaware of our ingrained behaviors and habits, and consequently, we move through lives partially on autopilot. For instance, you all have experienced, or many of you have experienced driving and thinking about A, B, or C thing on the way to work or on the way home or wherever, and not really realizing that you were paying attention to the signs and stopping for brake lights and these types of things. We do this all the time in our lives, and we do it a lot, or people do it a lot when they're under stress, this autopilot way of relating. And we think that it disrupts learning, and we think that it causes us to be less flexible and really miss out on some quality aspects of our lives. Next is acceptance. And when we talk about acceptance, we talk about this non-judgmental way of relating to our internal states, learning to be an observer of your own internal states, rather than, so if I'm experiencing anger, the anger isn't a thing that consumes me, and that I develop a stance where I can know that I'm angry, and that's okay. And it doesn't consume me, and my thoughts, I don't want to be thinking as if my thoughts are, my anger is not a thing that's happening as an event, it's my reaction to something. And then lastly, mindfulness brings about self-compassion. So this is partly through the non-judgment aspect of mindfulness, but also some of the skills that we cultivate in terms of non-judgment. I mean, I said that non-judgment, and also loving kindness. And loving kindness is a skill that we teach that really is about taking perspective on others and ourselves with kindness. Okay, what I'd like to do now is I'm going to have 3 different experiential opportunities for you. This first one is one that we'll actually engage and do, and the others I'll just talk about. So for this one, what I'd like you to do is to just listen to the bell that's going to be playing, and it will go on, and it'll stop, and it will come back again. And I want you to do is just pay attention to the bell. Don't do it in a way that's rigid or trying too hard. Just try to pay attention to the bell, and you might notice that it's a bit of time. It's going to be about 2 minutes, but you might notice that your mind wanders somewhere else. What I'd like you to do is just bring yourself back and pay attention to that sound of the bell. And secondly, there's going to be an instruction on the screen just saying close your eyes, and so I'd like you to close your eyes at that time. So here we go. Concentrate without straining. Okay, close your eyes whenever you're ready. Notice how the sound fades. Okay. So you probably noticed that your mind wandered from time to time as that was, went on for a bit. Often when these exercises are done, they might go on for 5 minutes, the bell such as this. In a classroom context, if you wanted to use something like this, 2 minutes would probably be fine. Oftentimes I will remind the kids or whoever I'm working with to if you notice that your mind is wandering, to bring your mind back to the sound of the bell. And so what's happening here in a very simple way is we're building a muscle. We're building an attention muscle to bring ourselves back to the present moment. And we can imagine I don't know, we've probably all experienced the situation where we've read through a page of some text, a book or something, and we get halfway through it and realize that we lost the thread of it, and our mind was someplace else. We bring ourselves back. And you know, everyone struggles with this from time to time. As you become a more sophisticated reader, you're able to do this, you're able to stay on task a bit better. But you can imagine how this general skill could be applicable in a lot of different ways. It could be applicable in the classroom, paying attention to a lesson, what have you. The important point is that through practice, again and again and again, we build this attention muscle, and we build it in a way that makes us robust to distracting situations. Noises blurted out in a classroom, or other distracting thoughts we might have about a video game or a song or an upcoming event. And really, it's this very simple skill that serves as a foundation for a mindfulness practice. Okay. There we go. One more. Okay. So another aspect of mindfulness that is a core session that's delivered throughout a mindfulness course is something called a body scan. And so in the body scan, students, be they children or adults, are instructed to focus their attention on the present moment using an anchor, for instance, their breath. And as your mind drifts away, you focus gently and you bring yourself back to the present moment. So you could have a group of individuals in a classroom, in a group, in a circle, and you'd sit there for 1, 2, 3, 4, 5 minutes, breathing, while the instructor says essentially the same instruction that was provided with the bell, reminding the student to bring their attention back to the present moment. And the student tries to simply observe their experience in the present moment without judging or modifying it. And again, this is a way to strengthen that present moment attention muscle so that it becomes a habit. So the way I like to think about it is, you've probably all heard about executive control, executive function, how we plan and inhibit and think. Paying attention, using that executive control can also become a habit, kind of moving away from the more autopilot way of relating to a more deliberate way of engaging. Okay, now I want to move on to another experiential aspect of mindfulness, and I'm just going to talk you through the idea. We're not going to do it here today, because if we were to do it, we'd be trying to do an entire mindfulness class or several classes in one day. So this is the idea of loving kindness. And in loving kindness, the way I think about it is, we're all constantly bombarded with all kinds of negative information in the news, or things that we have to take care of, et cetera, et cetera. There could be movies, could be what have you. There are things that kind of fill up our minds, and much of it is negative. It could be a worry, could be a rumination, could be just a hassle. And what can happen for some people, for many people, as Dr. Sadulski was talking about, is that they become preoccupied with these things. These become well-worn ruts that tend to fill the mind. Some people can become very good at coming up with and thinking about frequently negative thoughts. And so one way to tilt this in a different direction is to practice a different type of thought process as a habit. And that idea is to almost to ruminate about something positive. And so we start out with loving kindness for the self, and then and the reason why that is because we believe that loving kindness for the self, or self-compassion, is the bedrock for compassion for others. And so in such a situation, we'd ask a student to close their eyes and picture themselves somewhere they love. Could be in their backyard, could be, for me, it's on a river fishing, surrounded by things or people that make them happy and peaceful, and help them notice how they feel. So we're really focused on what it brings up for you. And once we've kind of got them in that place, then we'd ask the student or the individual to send the wishes silently after they hear each one to someone else. So we would say, may I be healthy and strong. And I would pause for a second and send that wish to myself. May I be happy. May I be peaceful. May I have joy in my life. May I welcome myself just as I am. And obviously we wouldn't move through it that quickly. But the idea is to embrace the self and to have these positive thoughts. We're cultivating a self-compassionate stance. And from that perspective, we believe that children and adults and most of us are in a better place to have loving kindness for other people. So it's an idea that is common in mental health, that self-loathing begets self-focus and a lack of consideration of other people. This is the flip side of it. Showing loving kindness to oneself is thought to set up a situation and a frame that promotes loving kindness and compassion for others. And so from that, we would move on to asking a student to close their eyes and picture someone they see every day that makes them happy. And it could be a person, it could be a pet or an animal. And we just ask, picture that person happy, smiling, perhaps doing something with someone they love, something that makes them smile. And again, notice how you feel. Notice how it makes you feel in your heart. And once they're in that space, then we ask them to move on and to send that person good wishes. So you're positively thinking about someone else. May that person be healthy or strong. May that person be happy. May that person be peaceful. Obviously with less rapidity than what I've just done, but you see the idea. And so we're creating instead of a negative loop, we're kind of creating a positive loop and a positive habit. And so the way to make this stick is to do it regularly. So mindfulness is not something you do reactively to an issue. Mindfulness is something that you do regularly to build resilience, so that when those difficult times come, you're in a more flexible and more accepting and more warm and kind and accepting frame of mind. Okay, so yes.
Can I interrupt you with a question?
Sure. Certainly.
So I know that we have probably a fair number of folks who work within schools and maybe not as mental health providers per se, but folks who work directly with students.
Mm-hmm.
And so I'm wondering if you can talk to us a little bit about, to put a frame around this, a little bit about how loving kindness really is related to child functioning within the classroom, and maybe some things they can start doing.
Okay, so how does it relate to the classroom? How they're functioning in the classroom? Well, you can imagine that a child comes to school, possibly things might be difficult at home, either financially, or there could be stress, or a range of things. And that might be impacting that child's academic functioning and academic performance. Perhaps the child is misbehaving in school, which draws negative attention to the child. So a lot of things that, you can imagine this child, all these things sticking to the child. Remember, self-concept, how a child feels about themselves is a function of things like how they perform in school, are they liked by other children? And what can happen over time through a lot of negative interactions is the self, a negative frame of self starts to emerge and become a feedback loop. And so the idea is that by shifting this frame and teaching the child how to identify positive aspects of themselves, we hope that this becomes a self-replicating process in a different way. And so you can imagine that a child comes to school and they've had not such a good experience at home or something, and they're in that frame of mind. But you move through these exercises and you're priming them to engage in a different way. You're resetting the system a little bit so that when they do their next exercise, or they move on, transition to the next thing that they're doing in class, that they have a more positive outlook. And it's not something that's going to work reactively in one shot. It's something that you do regularly over a period of time, weeks, months, as a habit. And what you expect is that frame will carry forward and shift the child's sense of self and their to a point of more positive emotion and positive affect about the self, and more consideration for others. So in terms of doing this in a classroom, I could envision something, boiling this down a bit, possibly in one class, just introducing the concept. And then in a subsequent class, maybe doing on one day, identifying aspects that you like about yourself. The teacher provides examples of things that they like about themselves. You can imagine some kids think it's funny or silly, and that's something that we always see. And it's important not to get drawn into that too much. If they struggle, you have some prompts ready to help them to come up with some things that they like about themselves. Sometimes the children emulate others and say the things that they said, which is fine. But anyway, the point is that it could be something that's done in just a few minutes a day. And the idea is that you introduce the concept and then engage the concept again and again and again, just a couple minutes a day to set the frame for the class of that day.
And so sort of integrating it into a regular practice, right? Once the seeds have been planted, cultivating those repeatedly over time. We have some additional questions related to mindfulness in the chat. So would you like for me to read a couple of those now, or would you like me to hold them until later?
See, why don't we hold for later, just because I want to make sure that I get through some things. I spoke a little bit more on some of the aspects than I intended to, but I think I'll be able to, I'll move along so that way we'll have time for people's questions.
Okay, we'll reserve some time at the end for those. Thank you.
Here we go. Thank you. Okay, so this mindfulness so I don't know if you all are familiar with meta-analyses, but what these are and what Dr. Sohadelski was talking about were, it's a way of taking many studies and combining them to see on average, are there effects for interventions or what have you? No one study really is definitive, but as we accumulate information, we can make a stronger statement. And so this was a meta-analysis on mindfulness in schools. And what they found, circled in green, was that really cognitive performance was most strongly impacted. So things like paying attention, inhibiting behavior, those types of things. But we also saw effects for emotional problems, stress, resilience. And then I will add, I didn't put it on the slide here, but really one thing that comes out is dose matters. So mindfulness is something, the reason why it's so impactful is because it's something you make a part of your daily life. And so it's the reason why I am advocating to do a little bit, before each class or before a day in a school, middle school or elementary school, is that it's a nudge, and that nudge cumulatively is what we're looking for. Okay, so let's shift to teachers, because really these mindfulness programs that are delivered, one of the tenets of mindfulness is that to be effective as an intervener or a deliverer of mindfulness, it's useful to do mindfulness yourself, just to know kind of what it's all about, to come from that frame. But it also turns out that mindfulness can be helpful to teachers who are bombarded with all kinds of burdens and stress, especially during COVID. So some of the things that mindfulness impacts are its metacognitive effects. So you can imagine when you're on autopilot, you may miss things. You may not think about or reflect on yourself. And so mindfulness really encourages that. It encourages a well-regulated self. So perhaps, attending to the immediate environment, what's happening in the classroom, and maybe not distracted by what's coming up in the next class. Sometimes there are negative events that can occur, and through these self-regulatory skills that are taught through mindfulness, it helps with not being drawn into what can be disruptive. And so there's been many different applications of mindfulness in schools. I'll talk a little bit about that next. And there's a lot of ways to get involved. So you don't have to do a formal course. You could do MBSR. They have an online course, but they have many different ways to get involved: books, YouTube, lectures, home practice. There are many different ways to, and now many apps actually that people are using as a way of bridging mindfulness and bringing into their lives. So there have been three major meta-analyses of mindfulness for teachers. This one that I'm emphasizing here, most recently by Zarati and colleagues, examine only mindfulness. And there are large effects for feelings of mindfulness. What I mean by that is, do people, teachers, know what mindfulness is? Can they report, what it's all about? And so they are getting those lessons. We're also seeing modern moderate effects for decreases in anxiety and stress, and small effects for depression and burnout. And so I would have liked to see more improvement for burnout, but I had said before, mindfulness isn't a cure-all for everything. It's one important part to a toolbox of things that are important, such as getting sleep, exercise, etc. So now I'm going to shift to learning the mindful brain. I'll say this, that was one of the things I was asked to speak about, but I don't want it to come across as, what I'm saying is more valuable or important or true because we see brain correlates of it. The brain, I'm a neuroscientist, and the reason why we study the brain is because we can get a more nuanced understanding of things and unpack them and break things down into their elements. But really, the reason why we're doing the mindfulness is for the outcomes we are targeting, learning or removing anxiety or stress, what have you. So Posner and colleagues came up with a model recently of mindfulness that targets the three main areas it hits: emotion regulation, attentional control, and self-awareness. These are all themes that I hit on before. Why would we engage in mindfulness? And really, this comes from the work of John Kabat-Zinn and MBSR. And what he was targeting was stress. And stress, chronic stress, is really negatively impactful on the brain. We see smaller hippocampal volumes. The hippocampus is very much involved in memory and memory consolidation. And neuroimaging studies have shown that children who are exposed to chronic stress have smaller hippocampal volumes. So it really sets them at a disadvantage in the classroom. Obviously, stress impairs performance in school in other ways. Preoccupying a child's mind, taking their attention off the lessons. But it also can actually have really detrimental effects on one's life, period, literally. Stress, through its effects on a cascade of neurobiological processes, actually affects telomere length. And so the telomeres are part of our genes that are involved in the cell replication. And as the telomere length shortens, there are fewer and fewer replications that can happen for our cells to grow and divide. And it's an indicator of the aging of our cells. And so what you want to see and what the research shows is that mindfulness actually halts this process. And then lastly, stress can impair the immune system. So people that are under stress are more likely to have inflammation, and inflammation has all kinds of a cascade of effects related to cancer and related to I'm blocking on what the other pain in the joints, etc. All those types of things. So the body aspect of mindfulness, or the body aspect of stress and how it wears on our bodies, is really targeted through a mindfulness approach. In terms of the brain circuitry and neurocircuitry that's hit, the reason why we see these brain effects, we think, is because it's something we're doing again and again and again. So it's this repetitivity that induces these brain plasticity changes. So you may have heard the word plasticity, and what that means is it allows new neural networks to grow and persist, and new connections to be built and foster more complex cognitive function, more flexibility, etc. So how does mindfulness work? There's it affects two main networks in the brain. One of these networks is for self-reference and self-regulation, and it's called it relates to an experiential form of self-awareness. It's instead of introspection, which is more narrative. So you can think about, are you focused on yourself and what just happened, or are you focused more on what's going on in your environment and what's in the present? And so the experiential form, or the ESA form of attention, is more about the present moment, and this narrative form of self-awareness is more focused on what's on your mind, what's worrying you, what's concerning you, etc. And so this ESA brain network involves the ventral and dorsal prefrontal cortex, the anterior insula, somatosensory cortex, and the inferior parietal lobules. And so these are aspects of hubs of the brain that are involved in self-regulation. Whereas NSA, or narrative forms of self-awareness, are more focused on midline frontal structures in the brain. So right up in we call it the anterior cingulate is the part of the brain we call it. And it's very much focused on attention for what's happening right there in front of you. And anxious people that are stressed out or irritable, have very strong reactions in this part of the brain when they're stressed and frustrated and when they're trying to pay attention. And it's thought that mindfulness doesn't make that part of the brain not work, but it encourages a flexibility across two parts of the brain, one anterior and one more posterior in the brain. Displayed graphically, this is this schematic comes from a review by Tang, Bosel, and Posner. And what it shows is, in the blue, sensation flows from our body into regions associated with present moment awareness, often activating a connected set of regions associated with descriptions and narratives evaluated in red. That's the midline part I was talking about. And so mindfulness really appears to weaken the body narrative association, so we can flexibly move in and out of what's happening to us in the present versus our self-focus and our narrative. Okay, I didn't anticipate we'd have these here like this. I'll just go this way. Ooh, all right. So introspection, awareness about how you think and process complex information, involves the rostrolateral prefrontal cortex. And so you can imagine that present moment attention that I was talking about with the mindfulness exercises, focusing on the present moment is really facilitated through that exercise, and puts the individual in a place for greater introspection. But also what we train in mindfulness is an awareness of our internal bodily states. So one of the other exercises that I didn't go over today is called a body scan. And in the body scan, you have the individual, child, adult, sit in a relaxed, quiet room, eyes closed, focusing on parts of their body and how they feel from head to toe in order, and noticing that your mind would wander, but bring yourself back to your internal experience of your body. And this is important because these experiences are what we call interoceptive cues. They're our internal states. They could be our heart beating. They could be hunger. They could be anything you can imagine that you can feel as an internal state. We want those things to be present in our attention and to notice them, but in a particular way. And so the mindfulness exercises really encourage engaging with these experiences and building a brain network that allows us to experience them in a dispassionate way. And then obviously I mentioned before hippocampus. So this, I think, mainly is by way of a reduction in stress, but there is some evidence that mindfulness may be actually impacting memory reconsolidation. And I'll share with you a little personal story about this that I think might, oh geez, we're already at 6 o'clock. Okay,
Yeah.
Just very quickly. I didn't do mindfulness with my first two children. And one example of what happened was I was in graduate school and they were in the tub and they were both in their little rings. I'm on my laptop and my daughter's pooping in the tub and I'm missing this. And I was under a lot of stress with my first two children in graduate school. And then I happened to engage in a class here at Yale, and it really got me going. And at that time, we had another young child, and I have much more vivid memories of him in some ways, I think, as a function of this mindfulness practice. So I remember giving him a bath, and I remember the suds on his chin and his little smile and the water running down his face. And the reason why I mention this is because this present moment attention affected my memory, right? And so I have for that experience, I have a deeper autobiographical memory. So I think that is one way also that mindfulness affects memory.
Mike, I'm going to interrupt you for a minute because I do want to be respectful of people's time. I know we got a little bit of a late start, so hopefully people can hang with us for a little bit, but I do want to give voice to a couple of questions that are in the chat.
Okay, so what I can do is with these slides were actually, we weren't sure if we're going to get to them. So, and Dennis and I had planned on this. So why don't we just go to right here, and then I'll answer questions and we can finish up.
Okay, so a couple of the questions have to do with differentiating mindfulness instruction and practices when working with individuals who are neurodivergent. So folks specifically asked questions about whether it's been utilized with children on the spectrum, also talking about kids with or addressing kids with attention deficits. So are there different applications of mindfulness when working with different populations?
Definitely. And this is true across other approaches as well. There have been studies and people do use mindfulness with kids on the spectrum and with kids with ADHD. And you could imagine, and in some sense, some of the core deficits of autism involve perspective taking and flexibility and awareness of internal states. And so what's done is, it's not that it's wildly different, the approach, but that it's given in much smaller increments. So, you might take more time to teach about internal bodily awareness it really depends on how verbal the child is. So if they're high functioning autism, it might come a bit easier. But really, some of the things are, so things like acceptance of one's emotions might be a more difficult thing to deliver, but present moment attention as just a habit can be taught relatively easily and is done. And so I would see that as I said, the introspective aspects and acceptance would be more difficult to possibly use with kids on the spectrum or with developmentally divergent kids. Kids that have ADHD or that have struggled with those concerns, there are studies being done, and it's used in treatment as well. The emphasis might be more on the present moment attention and building up self-regulatory skills. But I think, and there again, it might be just slowing things up a little bit. I don't think the intervention would be all that different from what would be done with typical kids, really.
So if, and I don't expect you to generate these right in the moment, but if you know of some resources for employing mindfulness techniques with individuals who are neurodivergent and would share them with us, I would be happy to pass them on to our attendees as well.
I'd be happy to do that.
Thank you. The next question, and I think this is the last question in our chat from tonight, is how do you get children to buy into this? So this is one where the person says, I can think of many students who can benefit from it, but they don't easily take it seriously and engage.
Okay, that's a great question. I mean, all the questions were great, but there's a few different angles that you can do to draw kids in. So we do things like, and I want to make sure that I have something to say at the end related to mindfulness in daily life. That's kind of more about quality of life. But we can draw kids in with things like, we'll do mindful eating with a raisin. Something that's easy to do, and they just, instead of, how do you normally eat? Normally when I eat raisins, they go pretty quickly, right? And so the instruction is that you hold the raisin in your mouth for a bit and notice the tanginess, and notice as you bite into it that the sweetness touches your tongue. So you really walk through the experience of eating something, right? So you have these different kind of child-friendly, small incremental experiences that you walk the child into. And in this way, really what you're trying to teach is to notice internal experiences and to reflect on them. And these little tasks are designed to prime the pump and to, in other words, if I were to say to you, oh, you're upset, just accept it. Like, those words don't really convey the meaning of it. And so these little exercises, for instance, like the mindful eating, are designed to build that bridge. One that I've developed just, as I'm fascinated with this because it's very difficult to articulate in some ways, what an internal state is and how you relate to it. And when someone's afraid or upset, all they know is that it's overwhelming. And that's not where I would start. So for instance, we've done things like, take a chocolate kiss and put it out there, but don't eat it. And notice that hunger feeling that you have, that you want to eat it, but not to eat it, and move your mind to something else. Or another one would be, we take a lottery ticket, scratch ticket, and instead of, and we imagine what it could win, then we tear it up. And we imagine that feeling, and we sit with that for a bit, and then we move our attention to something else. And so we're teaching this stance with these props, and kind of walking the kid in. Do we have time for a few more comments? I have something else I wanted to bring up.
Sure. So it's 6:03. I think, people will hop off as they need to, but certainly we can wrap up in the next couple of minutes. That would be great.
Okay. So mindfulness, it's very much being used to target problems, right? Although it is, but I also see it as a way of engaging life more fully. So I mentioned the example with my child, right? How many times have we done something where I have dinner sometimes with when I remember being an young assistant professor and having dinner with some famous psychologists and other professors, and I was so self-conscious that I missed the meal. And we were at Union League, and I missed the meal. I ate it, but I didn't notice it because I was so focused on. And there are a lot of examples like that. If I was preoccupied and we were hiking, I wasn't noticing the crunching of the leaves under my feet. I wasn't noticing the smell of the air. So I think a mindfulness practice actually can be a toolkit to engage life more fully. And that's, really another important aspect to it. So it's not just about regulating yourself, but it's kind of making sure that you're getting the most out of your life and your relationships. Lastly, if you want to bring mindfulness to schools, I put a few different websites and names of different programs that are out there. There are also a number of books that you can look at. I highly recommend the work of John Kabat-Zinn, but there are texts specifically for teachers. And with that, I leave you just to say thank you for your attention in the present moment. And I'll take any other questions if people have them.
We have one more question, and maybe this will be our final question, and that is a request to comment on circumstances where mindfulness might be too risky, say if there's a trauma history. Are there parameters to guide the decision-making surrounding that?
That is a great question. And there are, and this can be an issue. If you were in a classroom or you were working clinically and a child or whoever you're working with was finding that present moment attention was overwhelming with them, for them, you wouldn't walk them into it and say keep on doing it, because their way of coping is to not be in the present moment, and it might be too overwhelming from them. So it's not such a deep intervention that it's not like you're discussing someone's specific trauma that they've experienced and bringing it up and talking about it, which would be a very intense thing to do without any scaffolding. But I usually rely on the child or whomever to say, this is not working for me. I'm not, and part of it too is you have to keep an eye. So how is the kid engaging with it? Are they able to do it? And you might ask, how, by checking in, how's this going for you? And then trying to figure out whether it's they're just not getting it, or they're off focus, or they're just kind of new to it, or is it something deeper? This is not a real common thing, but I would say that it does require a bit more effort and skill when a trauma example comes up in the context of mindfulness. And I've seen and worked with myself situations where it comes up in a group setting, and I don't know that I would do it in a classroom per se. I might take a break and maybe have a private conversation separate, so that wouldn't put the individual on the spot. But in a group setting clinically, we do actually process it right there with the individual if they're able to do it, and kind of hold them and try to bring them in and create a comforting environment so that they can engage at the level they're able to.
Thank you.
Welcome.
So there are a couple, one is, can you go back to the previous slide for the book recommendations? And while we're on those, some other points of order. One is, I would like to let everyone know that this recording will be posted on the College of Ed main page under past colloquia once it has been downloaded and formatted. The other question that came up in the chat is one related to the slides. Given we did not necessarily get through all of these, would you be willing to share copies of your
Certainly.
presentation?
Yes,
Okay.
we're happy to.
Excellent.
Yes. And I did have my emails at the end, so feel free to contact myself or Dr. Sohodolski. Happy to share the slides with you.
Excellent.
And I can just add that the part that we skipped through is about anger management. And this is a topic that comes up quite a bit in context of anxiety and depression. And these questions are not always easy to separate, but we will be delighted to come back and give another presentation focused on those challenging emotions of anger and irritability.
Excellent. To be continued. Thank you, Dennis. Thank you, Mike. I certainly think this gave us a lot of food for thought. People are certainly interested in learning more about it, and I'm sure you'll be hearing from folks. I want to thank everyone for attending tonight and for bearing with us. I know this went a little bit longer than expected, and we started a little bit after the intended start point. So thank you for your patience. Thank you for your attention. And thank you for being present here tonight. I hope that we will see much more of you in the future. Please be on the lookout for an email about our upcoming colloquium this spring. The next should be at the end of May. Are there any concluding thoughts from Dean Hegedus or our alumni staff? Have I missed anything? Okay, well, thank you.
Thank you very much. Thank you.
Thank you both. Have a great night, everyone.
Thank you so
Bye.
much.
Take good care.